Hi, thanks for joining us. I'm really pleased to have the opportunity today to share some information with you about the health benefit exchanges or the health insurance exchanges that you're going to be eligible to buy health insurance from because of the Affordable Care Act. This is a tool for transparency and competition in health insurance. My name's Karen Kelly. I'm with New Hampshire Citizens Alliance, and we're a nonprofit, nonpartisan organization, advocacy organization that works on issues of social, political, and economic justice. And this program that we're doing is a collaborative program with many other organizations with New Hampshire Citizens Alliance and New Hampshire Voices for Health. So thanks for joining us. I'd like to suggest, while this slide is still available for you to see, that you perhaps want to write down my email address or my phone number. Keep a pencil and paper handy and write down questions that you have about the Affordable Care Act and these health benefit exchanges. Unfortunately, you may end up having more questions than answers at the end of the presentation. And that's because this is such a dynamic situation. Things have not landed. All the balls are still up in the air on it. And that's both a good thing and a frustrating thing. The good thing is that we have an opportunity to give input to what these exchanges are going to be like. And the not so good thing is that, that I am going to end up having a lot of questions probably come up. So I'd like you to take down my email number or my telephone number and make a list of questions, and feel free to contact me with any questions that come up for you about any of these issues. And I'll do my best to get back to you and answer those questions. So what is an exchange? A health benefit exchange is like a health insurance supermarket that's going to give individuals and small businesses in New Hampshire more choice about what insurance plans that they can buy and how much they will pay for coverage. As I indicated in the first slide, the best way to think about this is as a tool. Each state will have to have a fully operating exchange by January 1st, 2014. 2014 is also the year that a lot of other remaining benefits of the new healthcare law will go into effect, including prohibiting discrimination due to pre-existing conditions or gender, eliminating annual limits on insurance coverage, and increasing the small business tax credit, just to name a few. States had the option to have a state-facilitated exchange and some other options around coalitions. Right now, I'll just say that it looks like everything is indicating that we will have a federally facilitated exchange. I'll say more about this later, but I'll just put that out there in front just so that you know we will definitely have an exchange. And there has been some question about whether that would happen, but we will definitely have an exchange, but it will be a federally facilitated exchange. Massachusetts and Utah, by the way, are the only states that already have an exchange. And they will have to make some tweaks to the exchanges that they already have in order to incorporate some of the aspects of the Affordable Care Act. So where did the idea come from? The exchanges were originally endorsed by conservative think tanks like the Heritage Foundation and Republican Massachusetts Governor Mitt Romney. And they were discussed even during the 1994 health care reform debates. The idea was not utilized then, clearly, but it has become a key point in the Affordable Care Act concept. So what are the exchanges? An exchange could be thought of as a one-stop shop to find and compare affordable, quality health insurance options that individuals and small businesses can buy. One of the best ways to think about the exchanges is like if you're buying an airline ticket on the internet. Many of you have already used something like Expedia or Cheap Tickets, not to give them any airtime, but those are good examples of how as we move forward with the exchanges, that we will have the opportunity, like we do with airfare, to see side by side what it is that we want to purchase and be able to compare the plans and the prices. Another way to think about it is if you were going to buy a refrigerator, whether you're going to buy it online or in the store, you would look at what brand you like. You might not care about the brand. You might want just a basic refrigerator, or maybe you want a very fancy side-by-side, or maybe you want an environmental friendly one. Maybe you want an ice maker or water in the door, or the freezer on the bottom, or the freezer on the top. These are all aspects of or features of this refrigerator that you know are going to cost additional money, and you can tailor the refrigerator to look the way that you would like it to be. So this kind of comparison is a good way to think about how the insurance exchanges are going to be looking. We have some opportunities to compare side by side and to have some of the features that we want and not have other features that we don't want. This is going to help us compare prices and plans based on price and quality. Because of this, we're going to be lowering the cost of insurance because we have more transparency where we can actually see what we're buying in a way that hasn't been true with insurance in the past. We'll have better tools to be able to look at what it is that we're getting. There's also something called active purchaser, and that is an opportunity that may exist to be able to pull people together as long as they're working through the exchange to be able to get the kind of benefit that large companies have been able to get because they are pooling together. But the deal is with that, they will have to work through the exchanges as a negotiating unit. There are going to be options for multi-state aspects to the health insurance plans that you'll be able to purchase through the exchange. So if you, for example, live here in Londonderry and you want to continue to see your general practitioner who is here in Londonderry, then you're going to be able to do that. And then maybe you want to see a specialist who is over the line in Lawrence. There will be options that will allow you to have that cross-state possibility. So, who will use the exchanges and when? Obviously, the purpose of the health benefit exchanges are to make insurance more affordable and more easy to purchase for individuals and families who are purchasing their own coverage, and to small businesses. Probably businesses up to 50 employees, but it's possible that it could be 100. This is most likely going to be 50 in New Hampshire, but as I said, there's a lot of aspects of the Affordable Care Act that we don't have the dot at the end of the sentence at this point. What we do know is that in 2017, once the exchanges are fully up and running, states may have an option on whether they expand the use of the health benefit exchanges to even large companies. The exchanges will also screen and enroll people in Medicaid if they are eligible. As you know, we have Medicaid managed care that just started in New Hampshire or is currently underway, and that managed care is actually poised to work with the Affordable Care Act. Now, a few other notes, and there's a lot of misinformation that is out there, and a lot of confusion. So part of why we wanted to do this program today is to cut through some of that. So let me just make a few other notes. Insurance companies will not be required to sell their insurance through the exchanges. Now that might sound odd, and it probably won't happen, because this is actually a new market for insurance companies. So, of course, this is going to open those markets up for them. So in all likelihood, they will. But just like a friend of mine who works for a custom door making company, those custom doors are not available at some of the big stores that we all go to buy our building supplies. So it is possible that there will be that kind of situation for some insurance companies. But overall, the idea is that this will increase competition, and we have every reason to believe that, that most every insurance company will be selling their insurance through the exchanges, and that we will actually see more competition, more insurance companies doing that here in New Hampshire than we have in the past. Another little piece of information is that come 2014, January of 2014, our congressional leaders and their staff, if they want to have their employer, which is the federal government, purchase their health insurance, they are going to have to purchase it through the health benefit exchanges, the same as is available to us. It's also important to note, because of a lot of misinformation, is that undocumented immigrants and individuals who are incarcerated will not be able to buy insurance through the exchanges. And that, again, is to correct some misinformation. As we talk about the health benefit exchanges and how it's such a dynamic process right now, there will be lots of opportunities for advocacy where our voice about what we think should happen will really need to be heard. So I'm going to try throughout the presentation to point some of those points of advocacy out for you. Just wanting to make sure, and there will be many pivotal points. We have these already. Some of you have maybe already are involved as activists with New Hampshire Citizens Alliance and maybe have already been involved in some of this process. So again, I hope you have my email address, and if you want to be kept up to date with the kinds of opportunities there are for advocacy, please let us know, and we'll make sure that you are included in our notices. We put out both event and action alerts. Okay, so this is kind of the way it is now. When we're shopping for health insurance, sometimes it can be stressful and maybe actually contribute to are not being so healthy because it is stressful. I think in the past it has felt like we had to know, it was like reading a legal document. It was very complicated. There's usually, you know, a gazillion pages that we have to read through in language that most of us don't understand, and that just was not conducive to affordability and to a good kind of competition. People in the past would find a brand that they liked, or would just stick with a program, find a broker maybe that they liked, and have that trust factor. And that's great. Trust is important, but it's always better if we can actually look at what it is that we are purchasing and understand it very clearly ourselves. So this is where we're going. We're going to a supermarket of health insurance options. Information is power, and we no longer have to be an insurance executive expert to be able to purchase affordable health insurance. Now there's going to be a lot of different models on how the exchanges will be implemented. Everyone does have the option, I'll say this right now, to get insurance the way you've always gotten it. Some of the commercials that you might see on TV might indicate that the doctors that you see or the insurance that you have now, that you won't be able to have that anymore. And that is just not the case. You can continue to get insurance the way you're getting it now. No one has to go through the exchanges. The affordability might be better if you do. Okay, so how does it work? The law says that, the law being the Affordable Care Act, says that health insurance plans that are sold on the exchange must follow certain rules. First, they need to be affordable. Now I'm going to break this out just a little bit. We've already seen, since the Affordable Care Act came online in 2010, we've seen that individuals who are under 26 years of age have been able to stay on their parents' health insurance plans. One of the ways that this contributes to affordability is it puts a whole lot of young, healthy people into the pool for insurance. So even things like that maybe didn't make sense to everybody about why we were doing them is a factor that increases the affordability. We're doing a lot on prevention. So one of the ways I like to think of this period between now and 2014 and beyond really is that we're moving from an illness to a wellness model, that we're really trying to get people focused on how they can be in charge of their health and become and stay healthier maybe than we have in the past when we've been kind of working from a disease model around our health care. So there's been a lot of movement into prevention and wellness. There have been a lot of dollars into the state. I won't try to tell you the number because I don't want to misrepresent. But we've had all kinds of programs that deal with some tough issues like obesity that have already had prevention money that are coming into the state. Some tracking of illnesses has been also covered by the Affordable Care Act. The funds from the Affordable Care Act, and especially in the prevention area, have kind of infiltrated our health care and our public health system in a way that we don't always exactly know and can't exactly put our finger on where that as an individual we can't. But the people who are involved in these programs know that the funds that are helping them with prevention and wellness are coming from the Affordable Care Act. And again, the more we are oriented towards health and wellness, the less taxing the health insurance burden is and the health care system is. Part of what has also happened is we're through the Affordable Care Act, looking at the true cost of health care, of certain procedures, reducing fraud, reducing waste and abuse. And unfortunately, a lot of times when you hear numbers being thrown out about the Affordable Care Act, they're not factoring in the fact that the money around the Affordable Care Act has actually factored in a lot of these ways to reduce the fraud and waste. So part of the Affordable Care Act is that the more people that are involved in the exchanges and in getting health care, the more affordable it is to all of us. Now I've mentioned, there's two things that I haven't mentioned yet, and that has to do with how the insurance industry is monitored. There are two things that have already happened in the state. They're in effect, but they haven't kind of totally taken hold yet because it is kind of new. One is called rate review. That is also new, and it's actually very new because it's only been a few months now that the Executive Council in New Hampshire has approved the funds that have come into the state to be able to create the system to do rate review on premium prices for health insurance companies. So what this means is that no longer can a health insurance company just raise your rates without having justification for doing so. If the rates go over 10%, and probably in any case, even if they don't go over 10%, if I'm correct, they do have to justify those rate increases. And again, that is something new. The other thing that is new is medical loss ratio. You may have heard it as the 80-20 law, or I'm sorry, 80-20 rule. And what this means is that health insurance companies now have to make sure that 80% of your premium actually goes to your care, to health care. and only 20 of it can be used for things like advertising, CEO salaries, lobbying. So this is, again, new. And I will say that the insurance department in New Hampshire is very robust and rigorous about the way they have expected health insurance companies to be ethical and to justify their rates and to hold this ratio. So in New Hampshire, it's going to take a little bit longer for us to feel the benefit on the medical loss ratio because we're already doing that to some extent, but we need to move to the level of 80-20, which is defined in the law. There's a new development that I think people should know about in terms of advocacy, and that is there is a effort underway in the House of Representatives in Washington, D.C. that our legislative, our members of Congress are also in favor of, and that is to reduce that ratio so that more of it, or I should say less of it, goes to health care and more of it is able to be used for profit, basically, to the insurance industry. So we're very concerned that this medical loss ratio situation is possibly going to be diluted because ultimately it will affect the affordability that we are looking for in the Affordable Care Act. Let's see. So this is a point of advocacy, and this is another reason why we want to stay abreast of the things that are happening both in Washington, D.C. and the state, and be responsive to them and make sure that your voice is heard. I just yesterday got a memo that said that throughout the country, there's also consumers like you and I have already benefited a total of $2.1 billion because of medical loss ratio and because of rate review. Some of you might know that, it was maybe 4 months ago, there was a lot of people got a letter that they were getting a refund through their employer that may act as a rebate on your premium, but they were getting money back from their health insurance company. And that was because $1.1 billion of the 2.1 that I mentioned was insurance companies having to give back money because they didn't meet that 80-20 rule. So we already are benefiting from both rate review and medical loss ratio, and it's very important that those things don't get diluted because it's very much part of what makes the Affordable Care Act affordable, which is the aspect that we're talking about now. Just a couple more things about affordability. We'll be talking more about how this works, but certain individuals will be eligible for tax credits to help them with their premium. And also there's cost sharing that will have a cap to how much you have to pay. Now, cost sharing is both your deductible and your copay. And there will be a cap that is similar to what you have now perhaps in your health savings accounts. And I'm not going to give you hard numbers on this right now, but there will be subsidies for certain people at income levels that we'll discuss later that will also have help with that, so that for a given individual, the affordability may be enhanced because they're getting tax credits and or getting these cost-sharing subsidies. And then it might be possible that by pooling together that certain individuals might be able and businesses might have a more affordable opportunity as well. So there's a lot on affordability, but that's a big factor, certainly, because I think we've seen health insurance costs. I think I heard that it was tripled that in the last couple of years that our costs have gone up that much. So affordability is certainly a big factor. But quality and the fact that these plans must be clear are also very much part of the Affordable Care Act. So we're going to move forward and look a little bit at quality. Okay, the quality is basically defined through essential health benefits and the essential health benefit package. Just today, I was in the Legislative Office building in Concord at a meeting of the Joint Healthcare Reform Oversight Committee. And this is a committee of 3 senators and 3 representatives that are tasked with certain responsibilities in implementing the Affordable Care Act. One of them is deciding on the essential health benefits package. Now, when you see this list on your screen, it just is some examples of the kinds of things, kinds of services that we may be talking about that would be included as or considered, I should say, as an essential health benefit. What the Oversight Committee has been tasked to do, and this is part of setting up the federally facilitated exchange, is that the state does have to define what those essential health benefits are. And they have to fit in 10 categories. And I'm sorry to say we're not really going to go too deep into that right now, but I can give you some references of where you can go to learn more about that. And this is definitely a work in progress. I thought it was going to get voted on today, but the committee decided not to vote on it today. But what they're doing is they're looking at plans that already exist in New Hampshire and using them as benchmarks to look at what would be the best package of essential health benefits. Now, in terms of quality, for a health insurance plan to be included in the health benefit exchanges, it has to meet this, it has to be a quality, I'm forgetting there's an acronym out there, but it has to be a quality health benefit, so it has to meet these quality standards. And that means to be able to meet that quality, it has to have these essential health benefits that are in the package that we are in the process of defining now in New Hampshire. We are concerned that the Oversight Committee did not give an opportunity for public input, but it's not a done deal yet because they didn't vote today. And for anyone who's interested, this may be aired after the fact, but on the 19th, the Oversight Committee will meet again, and we'll have an opportunity to give input to the members of that committee by writing them a letter, an email, or giving them a call prior to the meeting, because at the meeting there is not an opportunity for public input. But these are the important pieces, the important services that, to be a quality health insurance plan, we need to include, and so we need to define those. It's a little more complicated in New Hampshire because New Hampshire actually has their own state-defined, mandated essential health benefits. So ideally, you would want those things to the federal and the state to match. And again, it's very complicated. It's a work in progress, but there is an opportunity right now to take a look at this and to weigh in on what you think should happen. A lot of concern happens to be around dental and some situations for children, some services for children that may not be available in some of the things that are being considered right now. So this is very important, and I hope you'll join me in advocating by learning more about this. I would recommend that at the end of this program you'll see some websites that you can go to, and those would be good places to find some specific information. But as I said, you can always email me and I will send you some more information. Okay, so how does it work? For the most part, the exchanges are going to be web-based. that you're going to be able to, like you do so many other things perhaps now for many people, you're going to be wanting to be in your pajamas at night, maybe even in front of the TV, and be able to make these comparisons, or at least to do it in the comfort of your own home, where you can really sit with the information and make your decisions. However, we all know that that's not the best way for everyone. So what, as a point of advocacy, we need to do is we need to make sure that every way that people currently buy their health insurance, whether it's face-to-face or over the phone or by mail, that those opportunities still exist to be able to use whatever venue works best for you, because not everyone is online and using the internet, and we can't let the digital divide be something that gets in the way of people having their affordable care. So there are some other things that we need to, that I want to explain to in terms of how it works, is that there's going to be the comparison tool, and I'll be showing you a slide in a minute about what that looks like. But that goes back to what I said about what it looks like when we go online now to buy an airline ticket. No longer do we call the various airlines quite so much. Some people do, and you can still do that, but it's much easier to just say, this is where I want to go, and who's got the best offer. And that's very similar. That's the comparison tool. There's also something called Summary of Benefits, and this is a straightforward, standardized way for you to be able, and for us to be able to know what it is that any particular health insurance plan is offering to us. And I'm going to be showing you another slide about that. Also, there's going to be a uniform glossary of terms. So it's going to be right there in writing that when I say copay and you say copay and the insurance company says copay, we're all talking about the same thing, and that applies to a variety of terms that we all use when we're talking about insurance. And again, the whole legalese thing that we've fallen into in the past that kind of made us beholden to the experts, that's going to go away because we have this standardization where we can sit down and make an intellectual decision about it ourselves because it's in simple language that we can all understand. We don't have to be an expert. Okay, now there's a couple of slides coming up here that you're going to look at and you're going to go, oh my gosh, I can't read that. I understand that, and I apologize, and I just want to tell you that right now, don't worry too much about getting too close to your television to try to see it. We're just trying to give you an idea of what it is going to look like. So this is the summary of benefits that I was talking about with you. This is an idea of what that would look like. So it's kind of like nutritional labeling on a jar when you're, or any item when you go into the grocery store. You can think about it in that way. So any plan that you're looking at, you'll be able to get a very detailed explanation of what they will cover. And what the insurance companies will do, who are providing this for the plan that you're looking at, is they will compare what it would cost to have a baby, to treat breast cancer, and to manage diabetes. Now, obviously, we all have a lot of health issues that aren't those three, and there will be more that will be out there as an example. But by having everyone talk about the same examples, you're going to be able to look at these summary of benefits and be able to see what it is that is being covered by a particular insurance carrier. So you're going to be able to compare apples to apples a little bit, well, a lot more than you've been able to in the past. Now, when you get these summary of benefits, what's going to be unusual and new and different and enlightening is that there is a restriction on how many pages it will be, and all the font, all the print has to be at least 12 point, which is pretty much what most of us would be used to seeing if somebody sent us a letter that had been typed on the computer. These are scheduled to be available actually still in 2012. I haven't heard too much about that, so I'm not sure where we stand with that, but it is a critical resource and it will become available to us. Small business owners might particularly be interested in this because they are needing to not only figure out what it is that they're buying, but they need to be able to then turn around and explain it to their employees. So this is going to be a tool that helps us really understand, again, in plain, standardized language. Now, part of the summary of benefits is another form such as this. Now, this is actually a true form that was found in the Massachusetts. It's called the Mass Connector, is what Massachusetts calls their exchange program. And so through their connector, this page that you're seeing here was accessed through an online search that asked for information such as their city, family size, types of plans, and again, you know, being able to compare apples to apples. So again, anyone who's ever purchased an airline ticket online, you're going to look at this, I'm sure like I did, and it's going to look very familiar because you're truly looking at what the alternatives are and approximately what the cost of them is going to be. And again, this is a little bit hard to see all the detail, but it breaks it out in terms of what your plan is. Like, for example, the very top one, the Bronze Low Benefits Package, has 6 plans available. Again, this is not to say that New Hampshire's plan will look just like this. This is just an example of what Massachusetts is already doing. And it's likely that we will have something similar, at least in terms of the standardization. So in this case, you see that there are 6 different plans available within the bronze level. And if you go all the way down, you have the gold level, and there are 5 plans available. And they talk about what the annual deductible is, the out-of-pocket expenses. And again, it may not be exactly everything, and this is just one piece of information that you'll have to look at, but it's as close as having the opportunity to compare apples to apples as anything. We just haven't had anything like this in the past. So I just want to point out again, they have bronze, silver, gold, some have platinum, and this part is likely to be something we use also in New Hampshire. Now, within these plans, a couple of notes. First off, obviously, it's going to be easier to compare price. As far as small businesses go, and I'll say right now while I think of it that New Hampshire Citizens Alliance is doing some work with small businesses and businesses in general to really look at what does the Affordable Care Act mean to small businesses, what's going to be required, just as many details as we can help people understand. So again, as far as contacting me, and my colleague Jillian Dubois is also working with small businesses. We have programs that we're doing with small businesses, and again, we need small businesses in addition to individuals and families to have their voice heard so that they make sure that the exchange that we end up with and the plans that we have to offer in the exchanges are things that actually are plans that really do work for New Hampshire individuals and businesses. So within this, small businesses may be able to allow their employees to choose among all plans, or they might have them choose within a specific level. They could offer just one plan. There's a lot of freedom, and they can work out the plan with their employees as restrictive or not as they would like. At least this is what we understand right now. Within the exchange, the billing for small businesses will also be aggregated to make it a bit easier for small business owners to work within the exchange. Now, as a point of advocacy, I'm sorry that I have not confirmed this information yet, but my understanding is from a business owner that worked in Massachusetts, Massachusetts business owners have to go to the silver level or above is what I was told. And again, I could be wrong about this, but I'm mentioning it because if we want to make sure that businesses have plans and options that work for them, we need to make sure that the voice of business is at the table and heard in the options that we have for public forums. So I would encourage business owners, we do have a business sign-on letter on healthcare values that businesses can access, again, through contacting me through our website as well. Okay, so there's lots of options here. Okay, this is another slide that might be a little bit hard to see, but the reason I like to keep it here is that it gives an example, like it says for the bronze, that you might have a lower monthly cost and then higher costs when you receive medical services. And at the other end, the gold might have the highest monthly cost, but has lower costs when you receive medical services. And again, this is Massachusetts. This isn't ours, but it's likely ours will be somewhat similar. And what I like to point out about this is that I remember talking in one of the sessions that I did in the state with a woman who has not been able to afford health insurance, and she is really waiting and eager to have the Affordable Care Act and the exchanges really kick in so that she can purchase affordable insurance through these health benefit exchanges. Now for her, she has gone through her life for the last many years not going to the doctor all the time. So she probably is someone who would be able to, she probably won't go to the doctor that much now because she's not in the habit of doing that, and as long as she stays in fairly good health, she won't need to. So it might be good for her to think about something like the bronze level, where she's paying a lower cost every month, but when she does go, she's probably paying more than someone on the other end who has got the gold plan and is paying the high monthly cost and lower costs when they're going to receive the services. So lots of options there that we can expect in New Hampshire will look somewhat similar to this. Okay, now how it works. Some of you, well, we're looking at having customer service centers and navigators to help consumers understand and select their coverage options. Now, we need to, as a point of advocacy, make sure that our navigators are really well informed, armed with all the information about options, and make sure that they do not push people to the wrong door, that there has to be no wrong door. And we need to make sure that these navigators are working with people and they know about the tax credits and that they, are guiding people appropriately to what they are able to get. The best model for this is the ServiceLink program that works for Medicare. And I've had a lot of people ask questions about the navigators. And some of those people are people who do receive Medicare, and they are aware that the ServiceLink programs, which would be comparable to the navigators, are amazingly helpful and just help them understand what otherwise is a very complex process. So we really need to make sure that the navigators are knowledgeable just as the ServiceLink people are. And I think we have every reason to expect that in New Hampshire, because we are most likely going to have a totally federally facilitated exchange, not even a partnership exchange, that the federal government will learn from the history and from the process of Medicare to make sure that a lot of what is really working in Medicare continues to work for those of us who are operating within the health benefit exchanges. So, so we're looking forward to having that kind of service. Okay, now here's another question about how it works. And this is where things get a little bit tricky. At this point, probably it's better not so much to focus on the numbers that are on this slide, but to realize that the Affordable Care Act, again, as I said, is designed so that everybody can be involved. And it's a system that is designed so that the more people who are in the program, the more affordable the program is for everyone. So again, without getting too caught up in the numbers on this particular slide, let me just say that on one end, if you look at, and maybe I could actually ask to take the camera off the slide for a moment. Is that possible for me? Great, thank you. And because I think it helps to have sort of a different look at this. If we look at on one end of the spectrum of people in our state, we have some people who are already getting health insurance from brokers, from insurance companies, within their from their large employer, and that is not going to change for them unless they want it to change for them. And so on the other end, we have people who are in Medicaid as we know it now. And that is primarily people of low income with children. It's people with disabilities. And it's also people who are on Medicare but have gone into long-term facilities. Those are pretty much the cross-sampling of the people who are in traditional Medicaid as we know it. So in between those two ends, we have everybody else, basically. And what we know is, and the slide that you just saw, is if we take people who are 100% to 400% of the federal poverty level. Now, the federal poverty level is just over $11,000 a year. So anyone who is a single person making a little over $11,000 a year, up to 4 times that much, they are going to be in the group of people who are eligible for a tax credit to help them with their premium so that that health care is affordable to them. Now, that will be a process of looking at their income, and the tax credit that they receive will be some percentage of what their income is, but they will get help with their premium. And anyone over 400% of the federal poverty level is probably either making enough money to be able to buy insurance through the marketplaces without the extra help, or they're maybe in a job where they're already getting health insurance. So that's a group of people that is already going to be getting help with the 100 to the 400% of the federal poverty level. They will have these tax credits. And then if we narrow it a little bit more to people who are 100% to 250% of the federal poverty level, these individuals will not only get the tax credit, but they will get a cost-sharing subsidy. And so what that means is they will have some help with their deductible and with their copay, because those are the 2 cost-sharing aspects of any of our insurance premiums or what is not covered by the insurance premium. So we have this 100 to 400. So now all that we have left to look at that's not covered is the people who are not eligible for traditional Medicaid And again, the managed care system in New Hampshire is who's going to be taking care of those individuals who get traditional Medicaid. So from that line up to 100%, but without going into too much discussion, I'll tell you it's actually up to 133%. Some would even say 138%. So there's a little overlap there. Those are people who, and I'm going to advance the slide, so you might want to look at that for a second. So those are individuals who would benefit through an expanded Medicaid opportunity. You're going to hear more about this when the Supreme Court ruled on the constitutionality of the Affordable Care Act. They made a change from the way the law was written, which would have had states pretty much have to expand Medicaid. And now after the Supreme Court decision, the states are allowed to expand Medicaid, but they don't have to. There's not the same there's not the same kind of demand for them to do that. What becomes tricky about that is that because the way the law is written, the people who are in that gap, which is about 50 to 60,000 people in the state of New Hampshire, they unfortunately don't even get the tax credit or the cost-sharing subsidy that the people who have 100 to 400% of the federal poverty level. So these are the people who are under 133% of the federal poverty level. And without expanding the opportunity for Medicaid to these individuals, they unfortunately are less able to pay because of their income level and won't receive help. So there's another point of advocacy that will be coming up that we need to really keep our eye on, because in any state now the legislature in the state, along with other bodies such as the Executive Council, will be making decisions, and they have to actively make decisions about filling that gap. Without that gap, what unfortunately happens is that we have a lot of people who have no choice but to go into emergency rooms for help that otherwise they would go to their doctor for. And when they do that, it's expensive. A lot of times it either is going to be a choice for them about putting gas in their car to get to work, or getting medication, or paying off that bill. And in the past, there has been some uncompensated care that hospitals get to help out with those people who are in that situation. But because the way the law expected to not have that gap anymore, that uncompensated care is going to be going away. And so it just leaves us in a very tricky situation, and I'm alerting you to this so that you'll keep your eyes and ears open for opportunities to see where we're at in the state and to take every opportunity to weigh in. The thing that I think is really important to note here as well is that the people who are in that gap, they're the person who brought you breakfast at the restaurant. They're the person who you drop your kids off at daycare every day. So these are people who are working, but they don't have health insurance provided, and they're just not making enough money to be able to get some of the other help that is available. So it's important that we don't leave those people behind, because they are the people who keep our state moving. So I know that was a lot, and that is kind of tricky to look at that whole spectrum of who gets covered in what way. So I hope that it's understandable at least enough for you to ask me to clarify it if you have more questions. So we're going to leave that part. Just a word about small businesses. As was stated previously, in 2010, small businesses were actually eligible to already start getting a tax credit if they provided health insurance for their employees. And throughout the country, 4 million small businesses became eligible for a tax credit. It's very hard to figure out who those businesses are in New Hampshire because that's their private information. So I wish I could say that, you know, X number of businesses in New Hampshire were already receiving the tax credit, but I don't have a number for that. But I do know that I spoke to a business owner who has a restaurant business, a couple of businesses, and he does not have so many employees that he has to provide health insurance. And he has been doing it. He received the tax credit. He felt that it was a bit frustrating that he had to really work hard to get his accountant to figure out how to do it, and to get insurance companies to talk about the plans that they were offering. But he said it was totally worth it for him to get this tax credit, and he will look forward to when he can actually purchase through the exchanges in 2014. So there's a little bit of information, but I'm not going to go into the small business aspect. But again, please do feel free to contact me because we have programs specifically about that. A little bit of interesting tidbits here as we come to closure. The Congressional Budget Office estimates that 11.5 million people in 2014 will use the exchange, and in 2018 that there will be 27.1 million. That's almost triple. And that's exciting, and that most people who use the exchanges will be people who are eligible for subsidies, and those subsidies which include the tax credit, will average an estimated $4,600 per person in 2014. So that's exciting. So making it happen, we really do have to advocate. We have to make sure that our voice is heard in this process where we are still a work in progress to figure out what these are going to look like. And even though we have a strong likelihood that we will have a federally funded, federally facilitated exchange, and not even a partnership exchange, it doesn't mean that there's not opportunities. There is an advisory board that is already being formed that the Executive Council will be approving the members in the next few weeks. And that will be an advisory board that is very well represented, lots of constituents in the state, and will weigh in with the federal Health and Human Services, who will be helping to put together the exchange. So we really need your input. There's lots of opportunity for public education, and we will be having hearings, and we will be having ongoing stakeholder public forums for you to be able to weigh in. I want to make sure that you get to the slide. So I'm going to skip through these and make sure that you see that there's an opportunity for you to look at any of these websites. Another one that I don't have here is the New Hampshire Fiscal Policy Institute. If you would just, I don't want to give you the wrong website, and I don't have it here, but they have a lot of good information about what's happening in the state. So thank you so much for taking the time to listen to this presentation, and we hope to be hearing from you so that we can keep you informed and to answer your questions. Thanks very much. Be in good health.